Well, good morning, everybody. It is Monday, February the 8th. It's been a week since you've heard from me, all for very good reason. Had a little setback with my medication, which I'm going to get to, and just to kind of fill you guys in on what's going on. I'm now at home. I was in the hospital for exactly 1 day, and I was sent home. I was sent home without the movement machine, but I was sent home nicely with the cool pack, and that has been an absolute godsend. So there it is. The rest of my at-home supplies is water. I've got ice over here in case I need an ice bag for the inside of the top of my quad, which became a focal point of all of this because I had to have a larger surgery and a larger incision than what was expected. He got in there and found many bone spurs and many large bone spurs. So in order to take the bone spurs out, which are, say, up here in this area, and the original cut was here, obviously you have to open the cut up. So I've got about 28 staples in there. It's almost 12 inches worth of incision, and so not the gluing that I was looking for or hoping for, but it is a nice looking incision with 28 staples. The rest of my at-home supplies, I've got my medications, I've got my daily vitamins and medications. In the kitchen, I've got my transfer bench that I use for my physical therapy when I do my leg flexions and my leg extensions, at least some extensions there. The rest of them I do here. And I also use it for when I take a shower. Let's see. It is Sunday after the Super Bowl, so congratulations, Peyton Manning. Sorry for all of you Cam Newton fans, but congratulations, Peyton. I had an episode or some problems with my tramadol, which I want to go over with everybody. I was taking tramadol and tramadol only. The dosage was 250 milligrams of tramadol every 6 hours for pain, which seemed to work okay while I was in the hospital, but unbeknownst to me, what I was really feeling in the hospital was more of the nerve block, and what I was feeling really wasn't taking place or really was having no effect. What I was feeling in the hospital, what I didn't know, was the nausea and the upset stomachs that are attributed as a byproduct and or a hazard, if you would be, of tramadol. So I was sent home with tramadol. I was also sent home with Percocet. And while I was at home, I only took the tramadol until yesterday morning, in which I started looking at the clock and realized here comes my 6 hours, and I was really hating the thought of actually having to take my pain medicine. I take the pain medicine, and yeah, it did. It took care of the pain. It made me extremely tired. It made me very nauseous. I was given Zofran, so I had Zofran here. That took care of it. My wife would make some wonderful meals in which I snubbed my nose at. So you lose your appetite with this stuff, and I didn't have to worry about constipation with it because I wasn't eating anything. Now again, tramadol is the lower end of your pain meds. It is a non-opiate. It's an NSAID, kind of along the lines of aspirin, but it has the effect and will attach to the OM receptors. So it acts like an opiate, but it is not an opiate. So with the pain I was having, I called my physician assistant yesterday and asked him, I said, look, I can't do this anymore. Is there a right way and a wrong way to stop taking it? I know you have to be careful when stopping an opiate, as I read, because it can cause withdrawal symptoms. And the doctor says, no, if you don't want to take it, don't take it. Try taking the Percocet. And what I told him, since I'm a recovering addict of 22 years, I wasn't going to take anything. And he says, well, if you can tolerate it, don't take anything. So that's what I did. Yesterday at 6 o'clock in the morning, when I was supposed to have my next dose of tramadol, I stopped taking it. And took only Tylenol every 4 hours and the ice. So between Tylenol and the ice, I've been actually okay. Slept all the way through last night, got up once to go to the bathroom, had to change my ice bottles. My water machine, our ice machine here in the refrigerator won't keep up. So what we have done is we've taken 12-ounce or 16-ounce water bottles, sports water bottles that you get at Walmart, and we have 16 of them freezing in the freezer. So every time I need to put ice in it, I put 4 in here. The ones I take out, I put them in the freezer, and we rotate as such. So anyway, that's where I'm at. I apologize for not getting back and not posting anything for a while. There just really wasn't anything to post. I will get to later today my rehab. I have met with my physical therapist. I've had physical therapists here every other day for home rehab. Not a lot, just strictly quad contractions, which gets the knee to go down. I'm doing them now, causing the knee to extend, squeeze, causing the knee to go down. And then just the opposite in the kitchen, I will put a towel underneath my heel with baby powder, making it easy to slide, and that way, this is the other leg, you can bring it up and slide it, bring it up and slide it, etc. So that's really what I've been doing, and I will show that later today. Right now I'm trying to get caught up on all my videos and get everything posted for you guys. So that's where I'm at, a little setback. I will say that you want to do whatever you can to manage your pain. This hurts. There is just no ifs, ands, or buts about it. It's not the resting pain that hurts, although it's not pleasant. It's the pain of physical therapy. For me, large incisions in the quad, that's where the pain is. The pain is in here. You can see by the bruising, and the pain is also this side of the kneecap and under the kneecap. And the under the kneecap is one of those things that all of a sudden it's there and then it's gone. So that's where the pain is. Everybody needs to manage it a little bit differently. Check with your physician, your surgeon, how you want to manage it, but you're going to have to figure out how you're going to manage your pain. I'll let you know later today when we work this, because I'm going to work through my first real hard set of rehab without the tramadol. And the reason I say that, yesterday I took the day off, not for the Super Bowl, but because I fell. And the walker I was given, and I didn't look, was put together incorrectly. It was put together by a place down here in southern Indiana. I'm not going to name names, but I will not go back to them. And what it caused it to do is it caused it to high center, and I went over forward with it. Now, I guess the good news is that I didn't get hurt. I caused a little damage to my hand, and it did cause a little jolt to my knee. But my doctor and everything, when I called my doctor, I said, why don't you just take the day off and sort of start over again. So with that, and the fact I'm only taking Tylenol, we took the day off yesterday. So today's about ready to start. I'll be getting to the kitchen here at about noon, which is about a half an hour or so, and then we'll go through a workout and I'll show you what I'm doing, and together we'll see how just Tylenol works. So we'll talk to everybody in a bit.